Good afternoon. My name is Miodrag Femic, and I'm representing a trade union of the physicians of the Republic of Srpska, a trade union of health workers is representing all the health workers in Republic of Srpska. We are founded in 2005, and we are the only trade union in the Republic of Srpska that having only medical professionals. We are fighting for economical and professional status that medical workers should have. That's the main goal of the trade union. The current situation in the Republic of Srpska is not on an enviable level. Due to all the scandals that are spread through the media and that are directly related to health, the political situation does not allow us to react to our consequences or directly affecting us. In the fight for our rights, the rights of health workers in Republic Srpska, we encounter obstacles and problems directly related to corruption at the state level, which have escalated due to the COVID-19 pandemic. There is awareness among the people of Republic of Srpska about the importance of climate change. However, the financial and human resources are lacking to deal with the consequences of these changes. This can be partly explained by the underdeveloped economy, specifically BDP, which is insufficient for the average citizen to think about the global problems that directly affects his life. Citizens are engaged in their existence and are not willing to sacrifice modest disposable income for the sake of a long-term interest. Therefore, the improvement of economic parameters should go hand in hand with the adaptation to climate change. In BiH, there are strategic and action plans in most cases created under pressure from the international community, but they are often unrealized and, well, dysfunctional. A concrete example of this is the National Plan for Combating the Pandemic of Bosnia and Herzegovina from 2009. In that context, the COVID-19 pandemic has shown us that objective reality and its consequences must not be neglected just because it's not in the temporary focus of the political and public. Thus, we could conclude that the national plan for the fight against the pandemic was not effective and the problems that arose were solved on the go. We, as representatives of the professional staff in the field of health, are directly affected by the COVID-19 pandemic, and I claim that the state was unprepared for the whole situation. Instead of support from the political and general public, we are underrated on the professional and public levels. The profession has not rested since the pandemic began. The Trade Union of Physicians of the Republic of Srpska is doing its best to provide its members with at least a peaceful sleep when they come home from the center of the pandemic. We are working on improving working conditions, insurance, the law and safety at work, as well as the most important thing, which is a monetary income that would be worthy of the job done. Let me present some facts about both Republic of Srpska and Bosnia and Herzegovina. The Dayton Peace Agreement, which ended the war, preserved external borders, existence and sovereignty of BiH, but created a complex, multi-ethnic, asymmetric federal state. As a result of the agreement, the state and its entities and unnecessary duplication of rules, institutions have negatively affected the effectiveness of decision-making process. In addition to the ethno-political stalemate, Republic of Srpska is additionally facing a regional depopulation trend due to the continuous immigration of young and skilled labor and low birth rates, with the country which reduced the competitiveness and productivity of the private sector as well. With this, we return to the problem of the political and wider public, which in our case is manipulated through the media. Healthcare workers are losing basic rights, not to mention privileges. While in EU, country special benefits are given to health workers who are on the front line in the fight against the COVID-19 pandemic. Republike Srpske is going to other extremes. non-existent resources, hot meals, and above all a low coefficient of the value of the work done. Faced with reality, we are threatened by the immigration of educated young staff who will seek a better future in the countries of Eastern Europe. The plan of the Trade Union Physicians of the Republic of Srpska is to help its members in the fight for their rights in all available ways, to enable them a peaceful sleep and justly paid effort. Republic of Srpska is not the only country facing an economic crisis, but it may be among the few countries where priorities are placed on marginal industries or neglected healthcare. The Trade Union of Physicians of the Republic of Srpska works to rejuvenate its members, whom it gives wings to fly in the fight against corruption, for their rights, as well as a safe house to which they can turn at any time. In the Republic of Srpska, changes are currently taking place in the law on protection from harassment at work. According to the current draft law, the number of victims expected to decrease, and employers to stop and think before taking a step in the legal direction. The Trade Union of Physicians of the Republic of Srpska plans various types of education in this field, both for its members and all interested health workers. The Republic The current law is far under European level, but we are planning and having a key reforms at the moment. The Republic of Srpska, with the status of a country in development, is falling behind the EU in the field of implementation of digitalization in the field of health. While other EU countries have come a long way and are already working on types of artificial intelligence, the Republic of Srpska is implementing basic software and distributing health cards that will provide easier and more transparent access to patient data. The implementation of digitalization began in 2019, and it was predicted to end by the end of 2020. Due to the COVID-19 pandemic, the project was delayed. Despite the delay, in this case, we are facing the problem of educating health workers to use digitalization. Due to poor access to training instead of progress, we are taking a step back. The profession does not always accept innovations, especially if they are not presented in the right way. They find it difficult to adapt to a new system which, instead of making it easier to function, sometimes makes it difficult. The Trade Union of Physicians of the Republic of Srpska is doing everything to provide its members with a valid and relevant education in the field of digitalization of the health system. Due to the current political situation, we expect support from the EU, Trade Union for Rights. Every kind of support and help is out of a great importance for us, our members and our youth. Thank you.